Good morning and welcome to our discussion for today. We are going to break the social stigma by discussing one of the most controversial diseases that a lot of people are either afraid or still too embarrassed to talk about, which is the HIV. So, just to give you an idea, here's the overview of what we are going to cover in our discussion. So, now let's dive deep into our first part and talk about what is HIV. So, human immunodeficiency virus, or more commonly known as HIV, is basically a virus that attacks the body's immune system. So, as we know, our body's immune system is responsible for fighting off infections in our body. So, if you have a virus that attacks the cells that protect you, then you may be exposed to different kinds of diseases if you are not treated right away. And this could lead to AIDS, which is the final stage of HIV, and it is a life-threatening condition. So, as of now, there is currently no effective cure. Once people get HIV, they have it for life. However, with the advanced technology and especially researches in medicine that we have, HIV can be considered as treatable. And how did this virus start? Let's talk about this one. It's pretty similar with COVID-19. So it didn't really start with human to human transmission. And so it started off with chimpanzees. So there's a virus circulating among chimps. They call it SIV. And it was transferred to humans as a result of chimps being killed, eaten, or their bloods getting into cuts or wounds of the hunter. But normally, a hunter's body would have fought off SAB, but on a few occasions, the virus adapted itself within its new human host and it became HIV-1, which is the most common HIV case that we have nowadays. And let's talk about the signs and symptoms. So HIV infections happens in three stages. Without treatment, it gets worse over time and eventually overpowers your immune system. So your symptoms will depend on your stage. So the first one is acute HIV infection symptoms. So most people don't know right away when they have been infected with HIV, but they may experience symptoms within 2 to 6 weeks after they have gotten the virus. So the symptoms are similar to flu, like you have fever, headache, a sore throat, you experience muscle pain. And so if you have symptoms like this and you might have come into contact with someone with HIV, so go to a doctor and ask that you get an HIV test. But if you don't have a symptoms like this, but still you think you might have come into contact with the virus, still get tested. So early testing is really important for two reasons. First one, at this stage, the HIV in your blood is really high, and this makes it especially contagious. Second, starting treatment right away is or as soon as possible might help you boost your immune system and it gives you peace of mind. And then the second one is clinical latency symptoms, or doctors call this the asymptomatic period. So without HIV treatment, people can stay at this stage for 10 to 15 years, but some people move through this stage a little faster. So at this stage, you may or may not experience any symptoms, but you can still pass the virus on to others. But it's extremely rare if you take your medicines exactly as prescribed and you keep an undetectable viral load. So viral load is the virus, like the number of virus inside your body or your blood, how much virus is present in your blood. And the next one, we have the AIDS symptoms. So AIDS is the final stage or the advanced stage of HIV infection where your immune system is badly damaged. So you may experience neurological symptoms like balance problems, seizures, confusions, bleeding that you cannot explain, fever that lasts more than 10 days, rapid weight loss. So people with AIDS who don't take medications live for about 3 years or less if they get another infection. So a lot of people worry what would it mean for their future if they tested positive and what other people would think. So remember, HIV is treatable, but only if you know you have gotten the virus. And the only way to know is to get tested. So testing regularly puts your mind at rest and it keeps you in control of your sexual health. So if you test negative, you can continue focus on staying negative and protect yourself. If you test positive, then you can take treatment to stay healthy. So remember, it's just a little prick. So let's talk about the testing methods. So we have two available testing methods. So they are typically performed on blood or oral fluid, but they may also be performed on urine. So the first one is laboratory test, in which, of course, you have to go to the laboratory or a clinic to take the test. And the second one is a self-test kit, more like rapid testing kit, where you can test yourself at home. So let's talk about first the laboratory test. So we have nucleic acid test, which can detect HIV sooner than any other types of test. So it can usually tell if you have HIV infection 10 to 33 days after an exposure. So it looks for the actual virus in the blood and it can either tell if a person has HIV or tell how much virus is present in the blood. So this is more like a confirmatory test. So later on, we'll talk about confirmatory tests. Next, we have a combination test. Uh, sometimes we call it fourth generation test, which is the antigen antibody test. So as the name suggests, it looks for both HIV antibodies and antigens in your blood. Okay, and let's go with the last one, which is the antibody test, which we also call rapid HIV testing. So HIV antibody test only look for antibodies to HIV in your blood or oral fluid. So in general, the rule is that antibody tests that use blood from a vein can detect HIV sooner after infection than tests done with blood from finger prick or oral fluid. So the only currently approved self-test kit is an antibody test. So you cannot do nucleic acid test at home. You cannot do antigen antibody test at home. It's only antibody test. So you're done with testing and you just got the result and it's positive. So what are you gonna do next? So testing positive is not the end, but only a beginning of a bigger journey or chapter of your life. So, if you have a positive HIV test, a follow-up test will be conducted. So, this is the confirmatory test, more like nucleic acid test. So, if the follow-up test is also positive, it means that you are HIV positive. If your follow-up test results confirms that you are infected with HIV, the next thing to take step is to protect your health and prevent transmission. So you can begin by talking to your healthcare provider about appropriate treatments for you. So your healthcare provider will help you decide what HIV medicines to take, and you could also join some support groups and socialize with people who have also experienced the same with you. So it's really, really good for your mental health to have someone who fully understands the situation without any judgment. So it gives you peace of mind again. And the last one is consistent treatment is really important in treating HIV. So it's really, really, really crucial to attend your appointments regularly. So, everyone, we can all reduce the risk of HIV infections by limiting exposure factors or risk factors. First one is male and female condom use. So, a lot of people don't know this, but we also have condoms for women. So, it looks like this one. And if you're sexually active, you should get yourself tested for HIV every 3 months and avoid sharing needles. And if you think you've been exposed to HIV, contact a healthcare provider right away. So now let's talk about the common perceptions of the society about HIV. First one is sharing of utensils can spread HIV. No, HIV cannot be passed on through sharing foods, drinks, or cooking utensils. even if the person preparing your food is living with HIV. So a lot of people still avoid individuals with HIV for fear of transmission. But HIV cannot transmitted through coming into contact with items used by individuals infected with HIV. So no, this is just a myth. Mosquitoes spread HIV. I think this is the oldest myth I've ever heard about HIV. So it's been going on around, especially in social media. And I believe, and believe it or not, some people really believe this, that HIV can be spread through mosquitoes. But the answer is no. You cannot get HIV from insects. So when an insect bites you, such as mosquito, it sucks your blood only. So it does not inject the blood of the last person it bit. Okay, so maybe if you have sex with the mosquitoes, yeah, but no, it's never gonna happen. Okay. And next one, we have hugging, kissing, and shaking hands. So kissing, and physical contacts is no. Okay, so HIV can only be transmitted through specific bodily fluids, so you cannot get HIV from touching someone, hugging them, or shaking their hand. Okay? And you can have sex with someone who is HIV positive without risking getting HIV. Individuals infected with HIV who are consistently taking their medications and have an undetectable viral load. So again, undetectable viral load is the amount of virus in a person's blood, infected person's blood, rather. They cannot spread HIV through sex. So this is referred to as U equals U, or undetectable is untransmittable. So people who are not infected with HIV can also take medications called PrEP. This is a medicine that can be used for people without HIV, but at a very high risk of acquiring it, and they can take it to prevent HIV, to avoid HIV. Okay, next one. Women who are infected with HIV cannot have children without passing on the virus. This is uh a myth, still a myth, but a lot of parents still experience that one. But we have this term called medical transmission, where the transmission of viruses can occur from parents to their offspring. However, interventions during pregnancy, labor, delivery, and even breastfeeding, vertical transmission rates can certainly be reduced to less than 1% and possibly reduced to zero. So even if a person has HIV, yes, she can still build her own family. As long as the mother is tested early during pregnancy and put on medications, we should be able to prevent all babies from getting HIV. And herbal medicines can help cure HIV. The answer is a hard no. So some people choose to take alternative forms of medicines, such as herbal medicines, as a natural way of treating HIV. However, herbal medicines do not really work, and taking herbal medicines can be dangerous as they will not protect your immune system from infections. There is no cure for HIV infections. However, with increasing access to HIV prevention, diagnosis, treatment, and care, uh, it has become manageable health condition. Okay, and the only way that you can stay healthy when living with HIV is to take the treatment prescribed by your doctor or healthcare professional. Okay, so that's all for our topic today. Thank you guys for listening, and if you have any questions, feel free to message. Have a great day. Thank you.